Hey everybody, it's Dr. Jason Barker with the Natural Athlete Clinic. Today we're going to talk about ankle sprains. So a few things to clarify first. What's the difference between a sprain and a strain? So a strain is just a very minor injury to the outside of your ankle typically, where you just kind of stretch those ligaments. Maybe you just kind of stepped funny off of a curb, something like that. Not a real big deal, feels a little tender, a little sore. You'll be fine probably in a few days. That's a strain. Doesn't really require a whole lot of treatment. However, a sprain is a different story. So a sprain is when we actually stretch or damage the ligaments in our ankle. And most often these are the ligaments on the outside of the ankle because we typically roll the ankle inward. It's called an inversion injury. So you can have a couple of different types of sprains. So a grade 1, you can think of it as just like a very minor stretching of that ligament. A grade 2 is where there's actually some tearing that has occurred. And then a grade 3 is a complete separation of that ligament. Usually the ligament either tears in half or it tears off of the bone. And that's a surgical fix. A grade 3 ankle sprain is not going to heal itself on its own. However, I'm going to talk to you today about ways that you can help heal up sprains regardless of what grade it is. So a few things to keep in mind. So we want that ankle to swell. So a lot of the things I'll tell you in these videos are kind of against conventional medicine. Swelling is good. Swelling is inflammation. Inflammation gets a very bad rap, right? We don't want chronic, widespread inflammation in your body, such as in your lungs, or in your brain, or in all of your joints. That type of inflammation is not good. Short-term or acute inflammation, such as when a part of your body gets injured, like an ankle sprain, is a good thing. Your body is smart, it knows what to do. So that's all that swelling you see is all the blood, and then there's lots and lots of chemical mediators or inflammatory chemicals that your body sends to that tissue to help repair it. So that's a good thing. Think about fevers also. Fevers are something that we want you to have. Fevers is having a fever is your body's way of making it inhospitable or an unwelcome place for that virus or that bacteria to live. So your immune system turns up the temperature, helps fight off that bug. You can think the same way about an ankle sprain. We want that swelling down there. All that swelling and all those chemicals that your body creates is helping to repair that tissue. Now you'll always hear this in conventional medicine, like get the swelling down, swelling's bad, you're gonna create more damage. That's not true, okay? There's no difference, there's no studies in the speed at which something heals, an ankle for instance, if you collaborate with anti-inflammatories and get the swelling down, or if you just let it heal up on its own. Of course, our job is to get you healed up quicker so you can get back in the game. But let it swell, okay? Now, a few things with that. Swelling is uncomfortable. Swelling is painful. You're not going to feel good. All right? We'll talk about you can use a few natural medicines that will take that inflammation down just a notch. It's okay to do that. We use anti-inflammatory formula a lot, which is our best natural anti-inflammatory. It has curcumin and bromelain and peptase and all kinds of other natural anti-inflammatories. You can read more about it on the website. But we'd have people just take a few of those throughout the day just to kind of turn the volume down on that inflammation. We don't want to do something like taking ibuprofen or the other non-steroidal anti-inflammatory drugs, or NSAIDs as they're called. Again, that's the kind of the conventional treatment is take 800 milligrams of ibuprofen 3 times a day to get that inflammation down. Well, there's a few things wrong with that. One, you're going to beat your liver and your kidneys up doing that. 2, there's a nasty little secret with NSAID medications, and they actually inhibit connective tissue from repairing itself. So connective tissue are things like ligaments, tendons, and cartilage. So NSAIDs actually slow down how those tissues repair themselves, so we don't want you taking those. In a pinch, yeah, sometimes an ibuprofen is okay to take. We're not completely anti-drug here. If you've got to go to work, or if you can't sleep and your ankle's swollen and it's really painful and you need something to take the edge off so you can think or you can sleep, that's good. We want you to sleep because that's also part of the healing process. So really try and limit how much ibuprofen you take. Rather, it's a better idea to take like a natural anti-inflammatory that's a lot more mild, acts more gently. That'll, like I said, turn down the volume on that. Other good thing to take for sprain and the inflammation involved with it is something we use called Ligament Restore. So Ligament Restore is a really cool product. I love it because it has collagen in it, which is the building block of those connective tissues, like in ligaments. It has proline and lysine, which are amino acids that also help build that collagen. And it's got some vitamin C in there, which is the most important vitamin that your connective tissue can use. So it's got all the ingredients in there that help rebuild those connective tissues. So if you've got a sprain, you've overstretched or you've partially torn that ligament. So we want to feed your body with those nutrients that'll help repair itself quicker. A couple other things to think about. Now, regardless of what kind of sprain you've got, your ankle is going to be big, it's going to be swollen. You need to get evaluated by somebody who understands sprains. Okay, why is that? Well, we need to know if it's one of those grade 1, a grade 2, or a grade 3. If it's a grade 3, you've got a tear in there and you're doing all of the natural things, that's fine, but it might end up being all for naught if you've actually got to end up getting surgery on that ligament. So get it evaluated, and then you need to work with somebody who, like a physical therapist, who can help rehabilitate that those ligaments in that joint. Because if we don't properly heal those ligaments down there in that sprained ankle, they're looser. The injury is or the repair is incomplete. So that can come back to haunt you, because if your ligaments are still a little bit loose, they're still not stable, maybe there's still a little swelling down there, that affects your body's proprioception. So that's how your brain interprets where your body is in space. So all your joints and things like that. If there's some swelling in there, the ligament's still stretched out, your brain's not gonna exactly know where that foot is. So easy way to set yourself up for another sprain. So make sure you get it rehabilitated properly. A physical therapist is a good person to work with for that, because we've all done this. Hey, ankle feels pretty good. I think I'll go for another run. Feels a little weird, but do it again. Bad news, then you're out of the game for a long time, and then of course you're at higher risk to do even further damage that time. So one other nutrient I want to talk about are omega-3s. Okay, omega-3s are those essential fatty acids. Essential meaning we absolutely need them. Our diets are typically very low in them. Comes from a lot of seafood primarily. You can get some omega-3s out of nuts and seeds and some plant oils like that, but fish oil is always it's a much richer source of omega-3. So omega-3s are anti-inflammatory. Other essential fats we need are omega-6s. Those come from animal products primarily. Our diets are generally low in omega-3 and high in omega-6. What happens with that? We get a lot more inflammation with that omega-6 to omega-3 imbalance. So that's why we supplement with omega-3. Sure, eating seafood is a good idea, but we're talking about medicinal amounts of omega-3. So that's where a supplement comes in. But again, that can help attenuate or kind of shorten up how much inflammation you've got brewing down in your ankle there. And remember, it's a very fine line with having some inflammation and maintaining it and letting it do its work, and letting it get out of control where you're in so much pain you can't do your day-to-day thing. So we want to have some inflammation, but we want to kind of keep it under a little bit of control. Omega-3s are great. The anti-inflammatory formula is great for that. NSAID drugs are too heavy of a tool for that. They'll really shut that inflammation down. And like all injuries and illnesses, if you just take the time, stay off of it, get some rest, let it heal properly, you're going to get back on your feet a lot sooner than if you kind of shortcut this and slam a bunch of ibuprofen down. Oh, the ankle's feeling good. You haven't done the rehab, and you get up and you go for another run or play basketball or something like that, and you tweak that again. So always be real conservative with your injuries. Less is always more with that. Okay, I hope that helps you understand ankle sprains. Again, we've got some good information on the website about ankle sprains and how to take care of them. Great nutrients, natural medicines to help you, again, maintain that inflammation in a healthy way so that it can heal up. Thanks for watching, and we'll see you guys soon.